So they all follow your lead. So they do a total knee revision to a higher constraint. Still, some would try, depending on the tissue, reconstruct the MCL, but none of them would choose the other option. So let me present what we did with the case. We basically changed just a liner. It was a persona knee with a PS, and I changed to a CPS liner. So now the second question we can discuss in a second will be basically, what are your worries for the future for this patient? And in this case, I'll let the audience see, but why did I decide to do a CPS is basically we have this option on the shelf. So what is CPS? CPS is something like a PS, the medial cam post is wider and higher, but it still doesn't go to a CCK. And I have the opportunity, if the prosthesis is in, opening the knee, I saw the hematoma on the medial side, so the trauma confirmed. It was not an injury that was there before, or there was something like mechanically not working with the prosthesis. So when I put in the trial for the CPS, I could receive very good stability. And this was for me a clear indication, okay, let's do the surgery much less harmful, much less extensive for a 72-year-old woman, and take the risk that we have now a little bit higher constraint without or enough fixation. And I think that's what we're going to be discussing a little bit more. Do you think, I don't know if you know that like CPS or a little like PS plus, some people call it, are you concerned in those cases that this can cause two complications for the primary total knee?
Yeah, question is, you have experience with this CPS or PS plus. Not every company does have it, so it's kind of a newer trend now. One of the questions, you are an experienced user with PS plus or CPS. Do you need stems with this special inlays or not?
And I think that's a little bit the point. If I know from the get-go, I will go with a CPS knee because I have insufficient balance and I know this is looking like a strong valgus where I won't be able to balance it out. I would put a stem in just to have additional fixation, a longer cement.